So I want to start today by talking about myself and Michael Liu. Michael Liu, who is now the Associate Administrator at the Maternal and Child Health Bureau, was an assistant professor at UCLA in 2003 when my boss at the Contra Costa County Health Department told me I had to go to a lecture down at UCLA in his place. I reluctantly went, and I have to say that it changed my professional life. Dr. Liu spoke about the LifeCourse Perspective. He talked about the ways in which social determinants of health and health equity affect and impact the lives that the families that we work with are living. He talked about low birth weight and infant mortality, and he said all that is connected. And that was something that I knew, because being the maternal and child health director for a large urban suburban county in Northern California, I saw that the women who lived in our county were getting into prenatal care early, within the first 3 months. In fact, we were #1 in the state of California in 1990, between 1990 and 2002, for early entry into care. But even though our women were getting into care early, we were still seeing very poor birth outcomes, particularly among our African American and our Latina residents. And we couldn't understand exactly what was going on. Especially among our African Americans, we had high infant mortality and low birth weight babies born under 5 pounds. When Dr. Liu spoke that day, and he talked about the LifeCourse Perspective, and he talked about the cumulative effect of risk factors and protective factors that unfold for all of us from our childhood through our adolescence and into adulthood, it put it all together for me. I was completely inspired, and I went back to my county health department. I said to my boss, I'm so glad you sent me to that lecture. And I launched a LifeCourse initiative in Contra Costa County that pretty much changed the face of the work we did there. And I'll talk a little bit about that as I go further here today. And what I wanted to say about that and the importance of that is that I began this relationship with Dr. Liu, this professional relationship where we work together to really make change happen in the maternal and child health world. Dr. Liu, along with Milt Kotelchuk, Mario Drummonds, and myself, wrote the Best Baby Zone grant. It was Dr. Liu's vision, and it was his baby. But at the time that we got funded in 2011, he was offered the position as the Associate Administrator for MCHB. He wasn't able to take the Best Baby Zone grant because he took this position, and he asked me if I would be the principal investigator, which is how I came to be running this project. But I want to give Dr. Liu the accolades and the credit for the vision, the inspiration, and the ideas about how to make a place-based initiative related to infant mortality that I think is going to make a difference in the lives of the families and the communities in which we're working. So today I'm going to talk about the 3 pillars of the work for Best Baby Zone. Place, and how place matters, how what surrounds us shapes us. Where we live is more important than our genetic code. Some people will say your zip code is more important than your genetic code. Then I'm going to talk about infant mortality, a problem which I think is one that many people here are very well aware of. If babies are born healthy in communities that allow them to thrive, we have healthy children, healthy young adults, and healthy adults. Children, babies really, are like the canary in the mine. If babies aren't born healthy, you know something isn't going right in a community. And then I'm going to talk about LifeCourse and how that trajectory from in utero through one's adulthood has a very big influence on the life that we live and the health that we have. So let's start with place. So where you live affects your health. If you live in a community that's considered a disinvested community, where you might have poor financial institutions, not safe parks, a lot of crime, maybe you have predatory lenders. I think we all know these neighborhoods. We've seen them, blighted businesses, many fast food restaurants. If you live in a community like that, chances are, researchers are telling us, that you'll have poor health status. But if you live in a community of opportunity, someplace where you have really strong financial institutions, so you've got good businesses, you've got local businesses, you've got good jobs, you've got good schools, clean air, you have good transportation access, chances are you're going to have good health status or better health status than if you live in a disinvested community. So this is a way of saying that place does matter. And I want to say that you have an excellent report here in Jefferson County, the Jefferson County Place Matters Report, and I'm going to talk about that in just a few minutes, that gives you some very excellent examples of the ways in which place matters in the communities that are in Jefferson County and that surround the city of Birmingham and beyond. So place is seen as a risk factor for some people, but place is also a solution. And one excellent example of that is a program up in Harlem called the Harlem Children's Zone. Now I know when Mario was here last year, for those of you who had the opportunity to hear him, he talked about his Northern Manhattan Perinatal Project and his MCH organization. Well, his MCH organization sits very close to the Harlem Children's Zone. The Harlem Children's Zone is a project that was conceived of and directed by Jeff Canada. It is a 10-block radius in Harlem that has $25 million invested in it, and the focus is education. And the focus of this project has been to start with parents who are pregnant, take them through baby college, have the children that are born of those parents attend schools, Harlem Gems, where the kids are part of a whole network of resources and support. The parents who participate are given a lot of resources to help them buy their apartments so they have investment in the community. The children are then taken on to junior high, middle school, and high school with the goal of taking them all the way through to college. And this has been an enormously successful program, not just around educational attainment, but also around health attainment and community ownership. And here's where a place has been transformed, where place, this 125th Street in Harlem and the block surrounding, was seen as a huge risk factor, and place became the solution. There are other place-based initiatives that are very popular here in the United States, growing. Promise Neighborhoods is one based on Harlem Children's Zone. Thrive is one. Thrive initiative is focused on mental health issues. Strive, and then the Magnolia Place, which is funded by the Anna E. Casey Foundation. There's one Magnolia Place that is growing in Atlanta. And when I think about place, I think about the fact that being here in Birmingham is an excellent place to talk about the importance of place and how it matters to the health of families. Because those of you who live here are very keenly aware that this is the birthplace of the civil rights movement, and it's also a place with a long history of segregation. And we know that in many ways segregation is an institution that has driven place-based disparities. So I think that it's particularly meaningful to be here in Birmingham, to be able to share in the history that has existed here. And that leads me to want to just give some accolades to the Center for Political and Economic Studies here in Birmingham and to the Health Department for this outstanding report. If you haven't read this report, I really encourage you to take some time and look at it. It's great. It's well written, it's accessible, and it has the kind of information that will help you as someone in the community really begin to understand some of the issues that are affecting the health of the families and the individuals that live here. I think some of the key statistics I want to draw out for you is to say that in Jefferson County, life expectancy can vary. It can vary as much as 20 years. That's pretty amazing. And that in 2011, more than 13% of the households in Jefferson County had annual incomes that were below the federal poverty level. That's about $22,000 for a family of 4. And finally, the infant mortality rate in Jefferson County was 2.5 times higher for African American women than for Caucasian women. You had 16 deaths per thousand among African American moms of newborns compared to 6.4 deaths per thousand among white women. That's a pretty staggering statistic. And that brings me to my next piece, which is about infant mortality. So this is the infant mortality rankings by country, and you'll see that the United States is down there at 49 at 5.98 deaths per thousand. And you have Monaco, Japan, Bermuda, Singapore. They have a much better infant mortality rate. They are not seeing as many babies die within the first year of life as we do. Here in the United States, on an average day, our statistics are not that good. We have about 11,000, almost 12,000 births a day. That's on an average day. Almost 1,500 of those babies are born preterm, and preterm means that they're less than 36 weeks gestation. So they haven't made it to that 42nd week. About almost 1,000 babies are born low birth weight, so that's less than 5.5 pounds. And close to 350 babies are born with a birth defect. We have 237 babies born preterm, less than 32 weeks gestation, 173 born very low birth weight, that's on an average day, 3.3 pounds, and 78 babies die each day before reaching their first birthday. That's infant mortality. Here's a look at the Healthy People 2010 goals for the U.S. I know that 2020 is about the same. I want you to see in this slide that the 2020 goal for the United States is about 5.8 deaths per thousand for infant mortality. And in 2008, among the African American population, we had over 14 deaths per thousand. And the Native Americans and Puerto Ricans at about 8. And as you can see, Caucasians are almost at the line, probably close to 6. Mexican, Cuban, and our Latina population are a little bit lower. So infant mortality has been a problem, continues to be a problem in our communities. It's a problem that I consider to be very complex, very complex. It's not just one thing. It's not just babies that are not born healthy. It's not just a mom who didn't take care of herself during pregnancy. And there isn't just one solution. Prenatal care is a really good alternative to making sure that we have healthy moms who can potentially have healthy babies. But it's not the only answer. And there's no one person or group or organization or sector that can fix it. And it's going to be hard to change quickly. It takes really a lot of puzzle pieces to make this puzzle a better picture. There are several national initiatives right now in the United States that are focused on improving birth outcomes, that are focused on reducing infant mortality and low birth weight births. Some are programs, some are policies, and some are media campaigns. A three-way approach that has been guided by the work of Dr. Liu at HRSA at the MCH Bureau. A few of the media campaigns are one that some of you may be familiar with. Is at the Southeast here. It's called Show Your Love. Another is Don't Rush Me. Have a baby, wait those full 40 weeks. And another is something that you're about to see probably sometime in September called The Raising of America. It's a film made by the same people who made Unnatural Causes by the California newsreel, and it focuses on the importance of early childhood and early childhood education. And it looks towards that period of early childhood as being the future of our nation. So these are media campaigns that are going to be talking about the issue of infant mortality. Then we have some incredibly exciting policy initiatives that are happening here in the U.S. right now. There's a Secretary's Advisory Council or Advisory Committee on Infant Mortality. There's a national initiative on preconception health and health care, which I think those of you who are involved in maternal and child health should be familiar with. And finally, we have the collaborative, innovative, and improvement networks, the COINs. And that's something that you here in Alabama that is very involved with the Southeast with Region 4. So these collaborative, innovative, and improvement networks are working with other states in your Region 4 to really move forward programs that are going to reduce infant mortality and improve birth outcomes. There are several programs, Every Woman Southeast, of which Alabama is one, Best Fed Beginnings, which is a national program to make baby-friendly hospitals more accessible here in the United States, where breastfeeding is the entry point and not formula feeding. And our National Healthy Start programs, National Healthy Start Association supports our Healthy Start programs, which you have a Healthy Start here in Birmingham, and you have work that's being done around the whole southern region where there are several very prominent Healthy Start programs. So all these projects have built towards what we consider to be our traditional perinatal continuum. Woman gets into care when she's pregnant. She sees the doctor or the nurse practitioner makes sure that she's getting the kind of care she needs to have a healthy baby. She goes through labor and delivery. There's the postpartum period. Hopefully she's gone to the postpartum visit. And then there's well child care for the newborn. And this is our traditional trajectory that we've seen over many years to try to reduce and address the issues of improving infant health, improving birth outcomes, and making sure women are healthy before, during, and after pregnancy. But the LifeCourse perspective broadens that view, and that's what I want to talk about next as the third pillar that holds up the best baby zone. So the LifeCourse perspective is a way of looking at life, like it says here, not as disconnected stages, but as an integrated continuum. So it's not just infancy, and then childhood, and then adolescence. It's all part of a whole. It's a perspective that helps us or seeks to understand and explain and improve health and disease patterns across population groups. So this is a graph that I hope will explain it a little bit more. So on one trajectory, on one axis, you have reproductive potential. And another axis, you see years of life, or life course. And this is a graph that Dr. Michael Liu and Neil Halfon produced as part of an article that they wrote in 2003 on the LifeCourse perspective. And what this diagram shows you is that the arrows that are pointing up, those are protective factors, and the arrows that are pointing down are risk factors. And the analysis here is that the more protective factors that someone experiences across their life course, not just during the period of pregnancy, but across their whole life, is going to improve their reproductive potential more than if they are experiencing a lot of risk factors. So this particular diagram was drawn to show the difference between reproductive potential for white women and African American women. African American women who may be experiencing more risk factors cumulatively across the life course, poverty and racism being the two most outstanding, but others, be it violence in communities, housing, poor opportunities for jobs, versus living in a place that is safe, living in a community of opportunity versus living in a disinvested community. That all of that makes a difference across one's life course. So there are two questions that the LifeCourse perspective seeks to answer. Why do health disparities exist and persist across population groups? And what are the factors, the protective and risk factors, that influence the capacity of individuals or populations to reach their full potential for health and well-being? So all of this brings together that idea of place, the problem of infant mortality, and life course. And that's what leads us to the best baby zone. So the best baby zone is a place-based initiative. It's a program initiative designed to improve infant mortality or reduce infant mortality, and it's based on the LifeCourse perspective. Our vision and mission. So our vision is that all babies are born healthy into communities that enable them to thrive and reach their full potential. That's a very tall vision, but we are aiming to get there. And our mission to do that is to give every baby born in a best baby zone the best chance in life. And we have a variety of ways that we're going about doing that. So here's how we plan to get there. First, we're working with communities that have an infrastructure already in place. They already have some services lined up. There are things already happening there to make change possible. They're not places where there's nothing going on with regard to women's health or infant health or children's health, because we needed some infrastructure to make it possible to move forward. Then we're working really closely with community members to establish and build community-driven leadership and ownership of this project so that we can achieve what we're calling community transformation. So really, this is a project about transforming communities to reduce infant mortality. And when the W.K. Kellogg Foundation funded us to do this work, they said, we want you to make a difference with regard to infant mortality. And we said, okay, we want to do that. That's our goal. But we can't just do it through the medical model. We have to do it through a bigger process of transforming small communities to make a difference where people live. And they were willing to give us the money, to give us the chance to do this and to try it. And in order to do that, we've been engaging the support, the expertise, and the technical assistance of a variety of partners, local partners, state partners, and national partners. That's been essential for this work. For our Best Baby Zone, we're working with 3 national partners, an organization called the Association of Maternal and Child Health Programs, which is in Washington, D.C., City Match, which is a national program based in Omaha, Nebraska, that works with cities around MCH issues, and the National Healthy Start Association, which is the program that is funded by the federal government to support all the Healthy Start grants in the United States. And the Healthy Start grants, as I tried to mention earlier, is very closely connected with reducing infant mortality in communities where they have high needs. So we've developed what we call our message platform. I promise I'll get to all the details about what's going on in the communities in just a minute, but we have our message platform. So we had a big idea, and our big idea was, when it comes to reducing infant mortality, or when it comes to reducing infant mortality, health means more than health care. And that's a really important thing for us. Health is the product of one's environment, opportunities, and experiences. So we believe, that it's important to address these interrelated conditions in a holistic, neighborhood-based approach. And that's what we've been doing. So what do? We're using this place-based approach, collective impact, which I'll talk about in a minute. We approach and engage residents and local community organizations in small neighborhood zones, and we try to help them to work with us to identify opportunities for collaborative action so that we can improve neighborhood health so that babies, mothers, and families thrive. Then, how are we doing it? Well, we're trying to be a catalyst and a convener. We're bringing together the resources and the people. We are trying to bring those people that have community vision together. We're trying to bring together people who don't usually come to the table. We are working with health services, we're working with early care and education, we're working with economic development folks, and we're working with community services and systems because we're trying to have a multi-sector approach. It's not just health, we want to bring in the other sectors to see if we can really make a difference. We have a variety of attributes that we think are important to the Best Baby Zone: community voice, innovation, collaboration, a concentrated effort, and then movement building. Because part of what we're doing a public health social movement here. We're not just going into a community and working with the residents to see what they might come up with and then leave, after we've made a few adjustments and help them change their communities. We're really trying to make change happen in a much bigger way, community by community, one community at a time, one zone at a time. And that is a public health social movement. And we bring to our work certain values. Communities at the center, equity, flexibility, because you've got to be flexible when you work with communities. It's not your agenda, it's their agenda. Integrity, optimism, and respect. And we came to these values over the course of many, many months of talking with our colleagues and talking with our community members about what are the values that we need to be working with and thinking about together. And I think it's important that when you work on projects like this, that you have some shared values. That's part of the collective impact work. That without shared values, you can't have shared end goals because people may be going at the work from different perspectives. So we really tried to come up with shared values that everybody could buy into and agree with. And I will say that it all looks very neat up here on a slide, but this was hours of conversations and arguments and discussions and disagreements and agreement, and finally resolutions and revisions. So I just want to say that this is work that takes time. This didn't get produced in a couple weeks. This probably took 8 to 10 months to come up with. But when I show it here in a slide, it looks like, oh, wow, they got it all together. Let me just say, getting it all together takes time. So here we have 3 strategies for the Best Baby Zone, and I'm excited to talk about them here. One, the first strategy is that we are identifying a defined geographic region where change is needed and where there already are resources aligned so we can produce and measure impact. The next strategy is that we're establishing what we call a broad collaborative of organizations to work across 4 key sectors. So health is one of our sectors, economic development is another, education and early care is the third, and then community systems. This is unusual for those of us in public health. We've tended to stay within the health sector, But without our partners in economic development, without our partners in the education field and community services and systems, we really can only make change in our very narrow window. And this work is considered collective impact, and funders today are very interested in this concept. There's a really interesting article written by some faculty out of Stanford on this concept of collective impact. And what it means is that rather than working in silos, that organizations and groups that come from different perspectives come together. They bring their different perspectives together to work on the same solution, the same problem. They have some shared outcomes, some shared goals. They have a backbone organization that's driving the work, and they have shared values. And they work together. And that actually, we're finding, is an exciting thing to be doing in some of these small communities, to be bringing in the banking community and to be talking with the financial institutions to say, if you would help to clean up some of these blighted businesses along this main street and move in some local vendors, it would improve the life of the people in this community. It could eventually improve the health of some of the people in the community. They'll become better earners, better spenders. They'll be better clients at the bank. They'll have healthier babies, and those babies will grow up to be healthy children who'll be better citizens. So we're trying to help people see that we're all connected. And our third strategy is the hardest, but I think one of the most important. That we're really trying to cultivate what I mentioned earlier, a public health social movement within each of the cities to rally community action that's aimed at social determinants of health, birth outcomes, and ultimately the quality of life for people overall. We're aiming at improving all of these. So it's not just a single focus, it's a broad focus to really make a social movement happen. You all with me? Yep. Okay, so now I'm going to talk about the 3 zones. So we have Cincinnati, Ohio, New Orleans, Louisiana, and Oakland, California. And people ask me, well, how are these zones picked? How did you decide on these 3? Well, it was Dr. Liu who picked these 3 zones. Well, actually, he picked 12. When the first grant that we wrote to the W.K. Kellogg Foundation had 12 cities. But Kellogg said to us, oh no, sorry, we can't give you $9 million. We can give you $2.75 million and you can do 3 sites. So we agreed. Each of these cities were places where Dr. Liu had gone to speak over the last many years. He had some connections there. He knew that the people who were working on infant mortality and low birth weight initiatives in these 3 cities had some support from higher ups. They had some sustainable funds. He also knew that there were already some programs already in place there. And so we picked those 3 as a way of knowing that we were starting with something, not starting from scratch. Because a 3-year grant is not very much time to get something up and running to be able to show that you can have success. So we needed some foundation. So let me start with Cincinnati and tell you a little bit about their story. So in Cincinnati, we're in 2 neighborhoods, the Lower and East Price Hill neighborhoods. And I'm going to show you a picture of that neighborhood and just show you on a map in a minute. But you can see some photos. And I was just there last week, which was really exciting for me. I'd never been to Cincinnati before. And we had an all-site Best Baby Zone meeting there where we brought all our sites, staff, and we got to tour the zone and really talk to some of the residents, and it was great. So within this border of East and Lower Price Hill, there's already a federally qualified health center that's run by the city health department. There's parks and other outdoor spaces. There's some strong community partners. There's a couple of new cafes that have popped up in this neighborhood, which has been fairly blighted. There's no schools in Price Hill, and there's only 1 bus that goes up the hill. So this hill is a very steep hill. There's 1 bus that goes up the hill. There's no buses that go transverse that cross the hill. So there's very poor transportation options, and everybody who lives there with children has to take their children out of Price Hill to take them to school. So here you get a picture of it. You can what's blocked out there is East Price Hill, and then Lower Price Hill is just to the right of that, and that's all the whole neighborhood that we're working in. You can see there's a variety of highways that run through or around Lower Price Hill, not really through, but around it. But there's really no public transportation to speak of. The demographics are really interesting here. There's largely a Caucasian population with a growing African American population and a much bigger Latino population now than when these statistics were put together in 2011. When I was there last week, they said almost 14% of their population now is Hispanic. Because there's a variety of renovation going on in downtown Cincinnati. And so what's happened is that everybody is being pushed out of downtown, people who've been living in downtown, and they're moving into these more adjacent neighborhoods. And Price Hill is one of them. So they're seeing an infusion of Guatemalan residents into Price Hill just within the last year and a half. The poverty rate there is pretty steep for all ages. 40.4%, and for children it's over 50%. In our Price Hill community, we're seeing about 355 births a year, and that's important as we talk about the projects here. So here's a few more statistics about Price Hill. 38% of the lower Price Hill residents are experiencing unemployment. That's high. 60% of the adolescents graduate from high school, which is a pretty good statistic. Not 100%. But at least over 50%. 42% of the women in Lower and East Price Hill report entering prenatal care in the first trimester. So that's not a very high number, considering that we're looking at 90% early entry into care. So that's pretty low. But we're hoping that we're going to make a difference with some of those statistics in the next few years. They've got a lot of community partners that are working together to bring the BBZ work together. So it's not just our Best Baby Zone team, but it's the team of Transforming Early Childhood Community Systems, which is called TECS, Santa Maria Community Center, and Every Child Succeeds, which is an organization focused on child's learning and health and development, brain development. So there's these three organizations that are working with our Best Baby Zone team to make change happen. So they're working the education end of the sectors. So remember I told you we had 4 sectors: health, economics, education, community services. They're taking the education sector and working closely with them. They're trying to work with their community services sector. They're working really hard. Santa Maria Community Services Center is trying to get more bus service in the Price Hill neighborhood, so that's all part and parcel of this project. Here's our monthly moms group. I wanted to show you this picture. This was established to promote community engagement, and this is a great story. So the woman in yellow in the middle, she's our community organizer there. Her name is Anita Brentley. She's organized this group of moms. They meet monthly. And they started out as a support group for women who have had babies, and so that we were giving them all kinds of things on a monthly basis that they might need for their children as the babies were starting to grow, as well as providing a group support and educational opportunities and parenting classes. But then Anita, who's a very smart community organizer, she's made this group her advisory group for the Best Baby Zone. And she's basically said to them, I need you to tell me how to make change happen here in Price Hill. And the women there have started to take this role very seriously. They've gotten some leadership training. They are participating on a regular basis with some other community organizations, giving them advice about what they see that has to happen. And the big Best Baby Zone project that these women have organized is called a pantry. It's not a food pantry. It's a clothes, furniture, shoes, household items pantry that they've pulled together. They've contacted people they know and contacted organizations to make donations. They've found a room in a church where they have housed all their goods. And what they've done is they've done outreach to women on their blocks in Price Hill. So they're being like block captains. They've been going around to the houses, letting women know about the pantry. And people are coming to the pantry either to get furniture for free or to get some new clothes or new shoes, whatever it might be they need, in hopes that they will use the money that they're saving from not having to buy those things to pay rent and to buy healthier food and to be able to support their children in better ways and to pay their bills. So this was all their idea. This is what they thought would have helped them, and they want this to help their friends and neighbors. So that's what's going on in Price Hill, and that's our Best Baby Zone project. And they have a variety of other things happening there, but that's one that I wanted to share with you. In New Orleans, our neighborhood is called Hollygrove. Now, Hollygrove is a well-established, has this very well-established community development corporation within the neighborhood. It has a variety of Healthy Start services, and they have a very strong community police force, which actually is a very important piece of the work in New Orleans. Hollygrove sits in a very interesting place in New Orleans. It's part of what they call Orleans Parish, which is a county. Well, you all probably know that. The parish is also the county. For us in California, it took me a while to understand that. And as you can see, Hollygrove is bordered by two major highways there, two major interstates. So there's no, so the interstate divides Hollygrove from the rest of the Orleans Parish. There is bus service and train service that exists in Hollygrove. There are a few parks, and there is a elementary school and there is a middle school. This community snapshot is a little hard probably for you to see, but I wanted to point out the unemployment rate, which is at about 21%. The number of high schoolers without a diploma, so about 20% of people don't have a diploma, not just high schoolers, but people who live in Hollygrove in our best baby zone as compared to the Orleans Parish overall. You'll see that the low birth weight births are at 20%, and you'll see that we have, and among the African American, we have 93% African American in Hollygrove versus 59% in Orleans Parish overall. So we have, it's got a very interesting breakdown here. The household income is about $25,000, so just above the federal poverty level for a family of 4. So 1 in 5 infants in Hollygrove are born low birth weight. 49% of the kids are living in poverty, and many external community rebuilding projects after Hurricane Katrina have not met the needs of the community. And I don't think that's a surprise to anybody. But Hollygrove is a place where things are happening. It is a hopping community. Here's the issue that our staff is working on, our Best Baby Zone staff. There's this train, Metairie, goes through Metairie. The community in Metairie is a very old, established community. People who've been there a long time, have a little more money than the people in Hollygrove, and they think it's time to move that train. Especially because, so the train where you see it now is the red line, is that red. And they want to move the train to where the green line is because the technology is now such that the train can turn that corner. See that corner down there near 10. So there's a big push on the part of the Hollygrove residents to say, no, we don't want that train going through our community. Because right now, there's 1 train a day that goes through Hollygrove. Okay? With the new train, 27 trains a day going through. And the trains won't just be passenger trains, they'll be industrial trains. So they'll be carrying toxic chemicals, they'll be stirring up dust, and the community feels they don't want it. So when our Best Baby Zone staff came to us and said, we want to work on this middle belt train controversy, we know it's not about infant mortality, but we think it's absolutely about infant mortality. We said, go right ahead. Because we knew that if they stepped up as the Best Baby Zone project and participated in this activity, that the community would have trust in them, that they would be building trust, the trust they needed to then do other work that they wanted to do. And this is exactly what we want to do. We want to help make communities better places for families to live. So they're working together to figure out a solution about how to not have that train come right through the middle of Hollygrove. It's been exciting, it's been a struggle, it's been hard, and they're working hard to make it happen. Another thing that they're doing in Hollygrove is that our staff have set up a table across the street from this house, which you can't see the whole picture of, which is a crack house that's right in the center of Hollygrove. It's on a main corner, it's across the street from a supermarket, and there's a lot of violence, there's a lot of gunshots, there are a lot of drug users that are going in and out of this house every hour on the hour. And our staff have made it a point to make a presence there of the Best Baby Zone to help the community residents who live around this house to be able to make change. So at Christmas time, they had a project with the community. They set up, they had like a little community fair, And they had the community write up their hopes and dreams for what could happen in Hollygrove as a result of working with the Best Baby Zone. So not only the train project, but also this house. And what happened was that a lot of kids came and they drew pictures and they wrote out sayings. And so the staff went up and everybody went up and they posted these signs on the house to say, enough, no more here, we don't want this anymore, we want this to be a place we can live together. And so there's really been a lot of organizing happening, so not just about the train, but also about trying to make the neighborhood a place where people feel safe, can walk around and live comfortably. So that's what our Hollygrove folks are doing. In the Castlemont neighborhood of Oakland, California, we are seeing big changes happen too. So this is our third site. Castlemont has this really strong presence of community organizations, a lot of service organizations. Youth Uprising, which is a terrific group that has been organized by a former community organizer, bringing together youth to really run an organization and shake things up in Castlemont, where there has been no services for youth for a long time. Brighter Beginnings is a perinatal care organization, and First 5 Alameda County is a statewide program, First 5, that focuses on child development 0 to 5. So we had a very strong foundation in Castlemont, and that's why the staff who are doing our Best Baby Zone project there selected this neighborhood. You can see Castlemont outlined there. What we know about Castlemont, we have a lot of statistics. One thing that I think is particularly interesting is that there's a 13-year difference in life expectancy between a child born in the Oakland Hills and a child born in Castlemont. So that's a little less than the 20 years that we saw in that Jefferson County report, but still very significant. There are about 5,000 people who live in the Castlemont neighborhood. We see about 100 births a year there. We have a very high unemployment rate, close to 40%, and we have an extremely high dropout rate. The dropout rate from high school has been increasing significantly over the last several years, and we're really trying to see if in Castlemont we can have an impact on that. The leading cause of death for residents in East Oakland between the ages of 14 and 24 is homicide, and Castlemont is an area that has seen an incredible amount of violence recently. In fact, 2 of the youth who work at Youth Uprising were caught in crossfire maybe 2 or 3 months ago. One of our staff had just pulled in the parking lot to Youth Uprising to go to a meeting, heard the gunfire, and got on the floor of her car. It's a very dangerous neighborhood, and it's a neighborhood that has seen a lot of change over the last few years, but there's still a lot of violence. Close to 15% of the infants that are born in Castlemont are born preterm, so they're born before 37 weeks. And on our statewide standardized exam, which we want to look at the changes that we're going to see, so we've been measuring baseline. So what we see now is that 80% of the students from the Castlemont neighborhood have scored below proficient in English language arts, and 94.6 scored below proficient in math. That's staggeringly poor educational outcomes. So in Castlemont, they're looking at something different than they're looking at in New Orleans and in Price Hill in terms of outcomes. They're looking at small wins with some innovative approaches, building relationships, and growing momentum. And the reason I'm giving you all these examples is that I think that there's potential for some of the work that we're doing with Best Baby Zone here in Alabama, whether it's in Birmingham or Montgomery, Selma, wherever you might be, Mobile. I want you to see that there's a how-to to taking that life course theory and turning it into practice. You know, sometimes I go and I talk about life course theory, and I was talking about this with Martha earlier. You know, I talk about the life course, I talk about cumulative stress across the life course, I talk about risk factors and protective factors and early programming, things that happen in utero. And then people say, well, what do we do about that? You know, that all sounds really interesting, but what do you do? And our Best Baby Zone, I hope, is giving people some ideas of what you can do or what we can do together with our communities to make something different. So in Castlemont, they're looking at these short-term wins for some long-term outcomes. So their long-term is really to focus on community ownership and leadership. That's what they really want. They want systems that are listening and responsive to the community. and they're looking at some shared measurement with clear roles. And so I'm going to focus on their short wins because I think that's where we are right now with regard to our work. We're in year 2 of the Best Baby Zone. We're just starting year 3 next week. So Castlemont has 5 focus areas. They're really trying to bring in all the sectors. So they're looking at building early childhood supports. They're doing that with these local childhood hubs, that they're childcare hubs, where they're almost like a pop-up childcare setting that happens in different places around the neighborhood every couple weeks. They're working together to build a local economy with the bankers in the community, with the businesses that exist there, with the community residents. They're doing a lot of resident engagement. They are doing partner engagement with the other organizations that are part of Castlemont that are already doing other work there. So rather than Best Baby Zone coming in and saying, okay, we're here, we're going to make things different, they're trying to work with all the partners that have already been there for a long time and say, we want to join you. Here's what we bring to the table. How can we help you? And they're doing foundational work, which means they're trying to raise money to gain sustainability for this work in Castlemont once our Best Baby Zone grant changes and goes away. So the piece that I picked to talk about here today is our resident engagement, because I think that's been something that has been incredibly successful, has been a lot of fun, and is moving them closer and closer to their community ownership piece. They had a big summer block party last summer in July that was so well attended. And as part of the block party, they had an arts and crafts table for everybody. And they asked everyone to, if they wanted to either draw a picture of what a healthy community looks like, or we took videos of people, what a healthy community looks like to you, and we posted those on our Best Baby Zone website. If you're interested, you should go and take a look at them. They're quite great. And we had people tweet what a Best Baby Zone, what a healthy community looks like. So they had the summer block party to begin to introduce the Best Baby Zone to the community. We provided food, we had activities for the kids, it went on for a couple of hours. We had a few local bands come and play. We're also doing what we're calling economic development chats and input sessions. So we're talking with community residents about what do they need to see to make their community have a more vibrant economy. We even had one of my students at School of Public Health at Berkeley do a photo voice project. So she did a project with 8 women who live in Castlemont talking about economic issues and what could make the community a better place to live financially. And I didn't include any of her photos in my presentation today, but I'm happy to share that with people that might be interested. It's an incredibly interesting look into the world of the finances of living in a neighborhood where there's lots of empty lots, and the women are saying, we could put a garden there. We could have a playground there. We could have something there that would be really useful for our kids. Or looking at a boarded up business and the picture of a boarded up business and the caption being, I don't want my kids walking by this boarded up business every day when they go to school because they'll think that they don't live in a very good place, and I want them to know they live in a good place. So it was really powerful, and we're trying to have more engagement around how to change the economic landscape in the community. We have developed what's been called a community market. So our Best Baby Zone team reached out to entrepreneurs in the community, craftspeople, artists, and every month, one Saturday a month, they've started a community market. So the first month I went, there were maybe 4 vendors, maybe 8 people. It was small, I have to say. The second month, it wasn't very much bigger, but a little bigger. But by January, we started to see maybe 8 or 9 vendors, maybe 40 or 50 people, and it's starting to get kind of word of mouth. People are starting to come. We also moved it. It was at the high school. People said, we don't want to go to the high school on Saturday. We want it somewhere else. Fine. So we moved it to another location, and that's when more people started coming. So it's been a process. It's not been easy, but the community is now getting invested in making the community market successful. And what we're trying to do now is help some of the local vendors get vendor license so that they can open up together in one of the boarded up businesses. So we're getting the bank to come in and help make certain locations available to some of the business people so they can put their businesses in there. So it's all part of this string of processes. We have some community cafes where people come together to talk with one another about a specific issue. So there have been 4 issues that the people in Castlemont identified that they wanted to focus on. And so every couple of weeks, the staff has a community cafe to focus on one of those issues, whether it's education, keeping kids in school, whether it's the community violence issue, which has been a very big one, having better businesses or a vibrant local economy, or how to get health insurance. We're starting a new project there called East Oakland Innovators. It's a community resident project where we're trying to bring in some of the residents to be innovators. We're going to train them to be block captains and to work with the community to actually do the work of the Best Baby Zone, to begin to see how do we make change happen there. And as a part of that, our East Oakland Innovators are going to be on a mini grant advisory committee. So we're going to have grants available to local people in the Castlemont neighborhood to do work in their area that might help to improve their community in a variety of ways. And our East Oakland Innovators are going to be the people making the decisions about who gets the money. So it's building momentum across the life course and within the community. As part of our Best Baby Zone work, we have had challenges. I think I've mentioned a few, but I want to talk about a couple more. This isn't easy work, but it is important work. So sometimes our staff have found that in the sites that they've had too much momentum. They've gotten things going too fast. And that coordinating all the work that starts to unfold is a little harder than they thought it was going to be. There are not very many of them. Each site only has 1 or 2 staff that are dedicated to Best Baby Zone. But once they get things going, people want more. So they've had to sort of manage the expectations and demands. Sometimes their role as a convener isn't very clear. Remember, I think I showed you, in our message platform how we do it. Well, convener is one of our roles. Well, sometimes being a convener gets in the way of other organizations that are trying to be conveners. So that's been a little bit of a struggle politically on the ground. It's not always easy to create a collaborative vision. And when you ask agencies that typically are competing to actually work together to create the right bundle of care or services, it's not always that easy because people worry about funding. Will they still get their funding? How will that interfere with the funding source? How is it going to work? Who's in charge? Who has the key to the building? Who gets the people there? How does that all work? So there's been that external alignment, then internal alignment, getting buy-in from the organizations they each work in. In Price Hill, the backbone organization is the Children's Hospital, Cincinnati Children's Hospital. In New Orleans, our backbone organization is the Healthy Start program. And in Oakland, our backbone organization is the Public Health Department. So the backbone organization is the one that's driving the Best Baby Zone. And sometimes it's been hard for each of those groups to get buy-in from the other people in their larger organization. And we know that this work takes time. So that's been the beginning of some of the challenges. We're aiming for some cohesive messaging, so multiple projects, providing resources in the neighborhood. Sometimes it's confusing to the residents, well, who's doing what? Promoting all the projects as an aligned system without taking credit. That's a challenge, but I think we're getting better at that. And aligning the forces around the community to work together. So that's all really been a big, as you can see, a big challenge. And it's not easy, but it's definitely been exciting. But then we have a lot of successes. And those successes feel very important to us. We have seen residents throughout the zones organizing and rallying their neighbors. And they've been rallying them to come to community events, to our awareness campaigns, and to taking some action steps. And in 1.5 years or 2 years of this work, that feels like a big step. And I know that may sound small, but it's really been important. And we've seen community members really coming forward, and they know what the Best Baby Zone is. They're excited about us being there. We've also seen some seamless systems of care, some seamless transitions between health, the health center, home visiting, moms groups, so that women who are coming to the health center who may be pregnant are then getting, they have their baby, they're then getting the home visits they need. It's all happening very seamlessly. They're part of the moms group. And then there are other community services that are being made available to them without a lot of friction, without the women having to run around, but rather it's all happening in one place. And the community organizations are really starting to work together in a concerted effort and of a more coordinated way. So we're seeing lots of momentum, sometimes good, sometimes not so good, but in this moment, it's great. We have engaged partners, county leaders and residents, so we're getting some political will moving. We're using design thinking as a promising method of residents' engagement and small win strategy. And I'll tell you what design thinking is in just a moment. And we're laying the groundwork for year 3. So design thinking is a strategy that's being used in Oakland, where they're bringing together community residents and having people talk, brainstorm really, about what they think needs to happen in the community to improve some aspect. And for the Oakland folks, they want to focus on economic development in their zone. And the community residents are really the ones that came up with this community market idea. I don't think that our Best Baby Zone team thought that that was such a good idea in the beginning. But through the design thinking process, they went through the steps of what it would look like, how it would look, how it would unfold, who would do it, who would be all the partners. And over the course of a really 2 or 3 days, they came up with this community market idea, and they launched it probably within a month or so of having had it. And the residents who were part of this design thinking process were a part of making the community market happen. So they're using this as a process to think about, well, what are some of the small things we can start with? How can we make things happen quickly so people see that we're there for the long haul? And here's just a picture of at the summer block party of what does a healthy community look like to you. And you can't really read them, of course, because it's too far away, but many of the pieces of paper talk about improving the community, reducing violence, having people have more respect for each other, getting rid of guns, having more activities for youth. You see, I think you can see the one that says Safe Oakland. And this was very exciting for us to do and to see this. And this was just the beginning of some of the things that people wrote. So I think you're wondering, well, that all sounds well and good. Okay, I've heard enough about that. How are they going to evaluate this? You know, how are they going to show that they've really done something? I think that's been one of the biggest challenges for a project like this, and I think it's one of the biggest challenges that we face in the maternal and child health field when we're trying to show change, especially with an issue like infant mortality or low birth weight births, because change takes time. It can sometimes take a generation, which can be about 15 years. Sometimes a little longer. So how do you show change? And this is something that we've really struggled with. So we've put together what we're calling our evaluation and learning platform, because we're going to learn from it. And we want it to really include measuring progress in a way that's going to be vital to those communities being transformed. So we're doing planning, we're gathering data, we're interpreting data, we're reporting and using the data. We have 2 major projects that we're working on now with regard to evaluation. We're doing process evaluation, where we're interviewing all the staff that have been part of the Best Baby Zone team from the beginning to figure out what's worked for them and what hasn't worked, because it's not just about measuring the outcomes in the community, it's also about being able to share the perspective from the staff, from the people who are doing the work, to share with people like you. So when you think, if you think, oh, we want to do something like this, what have been some of the things that have come up along the way, the challenges, the opportunities that they've faced, and how have they addressed them? We're also doing a community level survey where we're asking people in the zone a variety of questions. How do they feel about where they live, work, play, and learn? What do they like about where they live? What would they like to see changed? Do they have children? How old are their children? Do their children go to school? So we're asking some baseline data as well as some informational neighborhood data. Do you feel safe where you live? Can you walk at night by yourself or with a friend? We're trying to gather that kind of information. So the purpose of our evaluation and learning platform is really to inform and strengthen our local efforts, to measure and demonstrate the impact that our work is having, to better position our sites for future funding, because that is something that we're thinking about, and to facilitate the replication of the Best Baby Zone model nationwide. This is a learning process. I think evaluation is something that we often go into thinking we're going to come out with some good numbers that we're going to be able to really use. And we want that to be true here. So we're trying to learn as we go, not just have an evaluation that's already set in stone, but really change it as the data dictates. So this is a project where we have felt that we're definitely in this together, that this is, the Best Baby Zone is something that requires the input, insights, actionable engagement of lots of different sectors. We must have the planning sector there. We need child care. We need the medical field. We need to have our police and our safety officers, because we are in this project together. We can't do this alone. You know, I had a professor when I was in graduate school who said, you're either a yo-yo or you're a wit. The yo-yos are you're on your own, and the wits are we're in this together. And I've always wanted to be a wit, because when you're in it with your colleagues, you're all working towards a shared goal together. When you're on your own, it doesn't feel as positive, and it's harder to be optimistic. So we see this as a very important project of working closely with multi-sector partners to be able to make change happen. We have a couple social media sites. We have our Best Baby Zone website, which you should go and visit. We even have a Facebook page, and we are on Twitter. So if someone takes a picture of me, I can tweet it from here, right here in Birmingham, Alabama. And so I just want to recap where we've been together. And I hope you've followed me along here and that there's been some kernel of something that I've said that has stuck in your mind that you'll take with you today. That place does matter. And here in Jefferson County, you've got some great people working on place. And I think that those of you who look around where you live, where you work, where you play, where you learn, you'll see that place does matter. That infant mortality is a very serious issue that affects the lives of families and children, that affects community health, and that we want healthy babies. We want to see babies born healthy and able to thrive. And in order to do that, we've got to create the environments in which that can happen. And that LifeCourse does matter. That what happens to us in utero affects us across our life course. And what happens as we're children and teenagers, young adults, that's all part of it too. There's a whole science called the developmental origins of health and disease. And one of the people who is most well known, Dr. David Barker, he did some very interesting research that helped to contribute to this LifeCourse literature. And his research showed that a baby that was born low birth weight, a baby that was born at 5.5 pounds or lower, was at a greater risk for cardiovascular disease, diabetes, and other chronic diseases when they were an adult than a baby that was born at a normal birth weight. So what your birth weight is can have an effect on what your adult health is, unless you've got something in the middle there from birth to adult life that's going to improve it or help to divert that from happening. It's not just about healthy diet, although that's important. It's not just about exercise, although that's important. It's also about the reduction of stress, creating environments in which we live that are healthy places. So I want to thank you for listening. I love this picture of Dakota with her Best Baby Zone bag, and welcome you to engage in some discussion if there's time. Thank you very much.